We began to look at changing our appointment schedule because we were not satisfied with what was going on. Open access means that when a patient calls and if they're ill, they're seen that same day. So we start out every day with about 100 open appointments, but it fills almost consistently every day. If a patient comes in for a cold, we will handle their diabetes at the same time, their hypertension, any other chronic illnesses and conditions.
Okay, you take care of yourself, honey. You're welcome. Bye-bye.
We're really concerned about the whole patient.
The ability of the computer and data extraction, I think, is wonderful. And we know that by extracting the diabetics who've not been seen in 6 months, diabetics with a cholesterol over a certain level, a blood pressure over a certain level, that we've identified problem medical areas, and we can pull those people in and remedy that medical condition. When I discuss referral to a consultant or a specialist with the patient, within a minute or two I can generate a complete medical history. Specialists appreciate that and have come to rely on it.
We have staff meetings about every 6 to 8 weeks and sit down with the entire staff, talk about what's going on in the practice and look for opportunities for improvement. Whether they're large changes, small changes, try to get some feedback from the staff because they see things differently than the physicians see things, and often their input is valuable in making these changes.
When I have our staff meetings, I have a graph which I'll show, and there's not any doctors' names in particular, but their secret code number, which only they know. So they can look and see how they're doing compared to the group. Because I think competition helps. Most people always thought they did better than what the audit showed, but I think mostly they're happy with it because it helps them do a better job. And I think we're all in it to do a better job. The whole point of this is to try to make it easy.
The staff is very actively interested in competing with other practices that are in the consortium, because when we go to these meetings, you want to be the best. We have a graph that lists the basic parameters of the performance and the outcome data that's being collected. And when you get at or above the national benchmark, then you get a gold star. Not bonuses, not reimbursement, but a gold star was incredibly effective to get the staff involved with it. It works?
Yeah. We all here want to feel like we're doing better for our patients. And measurement really does help. And that, again, is what shook us up at the beginning, and it shakes people now. Now, acting on that is not necessarily easy. And there's a limit to how much one doc can do using his own or her own memory and pen and chart. But we're able to show that you can improve some things that way with commitment and then the tools to become more organized and do it.
Anthony? We had been doing flu campaigns each year for about 5 or 6 years. Then one summer I decided we weren't going to do it anymore. Middle of the flu season, I had a patient come in and tell me, Dr. Sobel, you didn't send a flu letter. And I said to her, but you've never gotten your flu shot. And she said to me, well, I always take the letter and go down to the senior center and get my flu shot down there because you charge $3 and the senior center is free. This is in the days before Medicare paid for flu shots. And I said, oh, great. But then she says to me, do you know Mrs. So-and-so, Mrs. So-and-so, and Mrs. So-and-so? And I said, yes. She said, well, I showed them the letter and told them how much I thought it was important that my doctor sent me a letter and was concerned about my health care. And now they come to you as patients. We've done it every year since then.
All physicians are seeing a turnover of patients based on switching insurance from this one to that one. And so we all have a certain rate of patients leaving the practice and going elsewhere. And it's gratifying that we have a very high rate of patients coming back saying, I'm willing to pay more out of pocket to see you because of the quality of care that you provide. And it's exactly that that allows us to bond with the patients, to have patient loyalty, and keeps us in business.
When you look at what we do versus sort of the broad swath of Medicaid places, we do pretty good. But we do strive to try to meet the measures no matter who people are, where they're from, and try to do better than average nationally.
When we expanded and got our ADA certification, one of the local insurers said that any practice that billed higher codes for diabetic patients who was ADA certified, they would not do any kind of focused review at all on these practices because they felt if these practices were delivering that level of care, they deserved to be reimbursed at a higher level. I think this is going to happen more and more.
It's very good reinforcement for the staff when I compare our results to like the NCQA results because we're doing as good or better a job. And the NCQA data is broken down for commercial, Medicare, and Medicaid. And even when we compare our numbers to commercial populations, we're better than they are.
The advice I would have for a physician approaching the aspect of quality is to decide on some area that is of interest and go at something small, something easy, achieve a measurable result, and then expand.
It turns out that doing quality improvement isn't hard. You can get on the internet and you can find out what standards of care are. It's easy to select patients' charts based on their age and their gender and to do simple audits. If you can recognize what you're doing well and what you can improve on, I think it gives you greater satisfaction.
Let's see here, your blood pressure, we've been checking.
The patients who come in and pull out their care cards or take off their shoes and socks, those are the two things that really impress me the most right at the beginning of an encounter. That something is working, they value what we're doing for their health, or they value what they're doing for their health, and they understand that there's something to this that makes a difference. Yeah, we're actually doing something right together in this process.
The ability and recognition of quality outcome has basically kept me in medicine. You need some sense that, hey, this is worth it. I enjoy what I'm doing. I am getting the positive feedback. It's going to keep me going until I retire. So that's where it's at.